Hello everyone. Hello, my name is Emma Envari and I'm a third year student here at Monash University. Today I'm chatting to some of our nursing and midwifery students to find out a little more about their degrees and what it's like to study at Monash. With us today we have An Lee, who is studying a Bachelor of Nursing, Caroline, who is undertaking a Bachelor of Nursing and Midwifery, and Justy, who is completing a Bachelor of Nursing. An Lee, would you like to tell us a little bit about your degree, please?
Yeah, sure. So Bachelor of Nursing is a 3-year degree, and that composed of lots of anatomy, physiology, and with placements as well. And all of them really helps me personally to prepare me for the clinical placement, and really help me to develop my confidence as a graduate nurse as well.
Wonderful. Thank you, An Lee. Now, can we hear from Caroline? Can you tell me about your experience and your degree, please?
Hi everyone, my name's Caroline. I'm studying the double degree, the Nursing and Midwifery, and it's a 4-year course at Monash University, and I'm based at the Peninsula campus. And I'm actually an international student. I'm from Singapore, and I came to Melbourne for the first time in first year of uni. And the reason I chose Monash University was because of the great reputation they had. I didn't really know that much about Australia before coming to Monash. But I heard that Monash had, great reputation and high employability rates. So I was like, sure, I'll come here, give it a go. And I want to safe to say that it's actually been I've had a really great time here at Monash. I think that the hands-on experiences here at Monash University is immense. The support is amazing. And I've just had a really great time the last 4 years. And what I love about my course is that you really get to be on placement from the first year, from the get-go. So you get to really hone your skills in the clinical environment from the very beginning. And that's what I love about studying at Monash the most.
That's brilliant to hear, Caroline. Thank you. And now we will hear from Justy.
Hello, everyone. My name is Justy. I'm also an international student from Kenya, and I'm currently in my 3rd and final year of Bachelor of Nursing at Monash. If I had to describe my nursing education at Monash in 3 words, I would use the words exciting, rewarding, and inspiring. I'd known for a long time that nursing is the area that I wanted to pursue, but my ultimate reasons for choosing Monash was the fact that they not only produce world-class healthcare professionals that are sought after globally, but also provide a myriad of opportunities during the course for students to practice and develop their clinical skills on several clinical placements. Also, being taught by professors and tutors who are nurses themselves adds like a special authenticity to the delivery of the course, because we're learning about the healthcare industry firsthand from people who are a part of it, and that has been something that I've truly appreciated at Monash. When I left my small town in Kenya and came here for the first time about 3 years ago, I had no idea what was coming my way. But in these 3 years, Monash has completely transformed me into this confident and dedicated person, and it's genuinely been the best thing that's happened to me.
That's so great to hear. Thank you. An Lee, what is the most challenging aspect of the Bachelor of Nursing course, in your opinion?
I think before I start my nursing degree, I never know that there was so much, anatomy knowledge that I have to learn, and there was so much about theories and how you put it into practice as well. That was something that I never expected, but in the end, it was really rewarding, because that really helps you to build up your knowledge and how to put into practice as well. And I think also the first time when I was on placement, I feel really terrified because I never know anything about Australian healthcare. But after the first placement, that really helped me to know what I want to do for my career. And I know that exactly nursing is what I love, and I want to continue that for my future career.
Thank you. Moving on to Caroline, you're studying a Bachelor of Nursing and Midwifery. So what do you do during labs for the dual degree?
So for the double degree and for the single degree, we get a lot of hands-on experiences, and we call that the clinical learning environments of the labs. So in first year, and depending on your course, you're usually going into class for the hands-on learning every week, and it's really fun. So in first year, you get to learn all the nursing skills from the get-go. So you're learning how to draw blood, you're learning how to put a catheter in, and that's what how Monash structures their course. So in first year, you're going to learn all the skills so that you can kind of practice that when you're on placement. And I think that's the best part about how Monash has structured their course. And for the double degree, we do all the nursing stuff. And on top of that, we do like midwifery labs, which include things like, how to deliver a baby, how do you, measure someone's abdomen to feel how the baby's growing and what position the baby's lying in. And you learn, and they're quite creative in the labs. You teach how to do like heel prick blood examinations on babies. So they put little like a marshmallow sponge thing with blood, and you prick the baby, the little mannequin. And as you move on into your second and third year, fourth year of uni, it becomes more of a scenario-based lab. So you're going to have a patient with patient history, and something will happen, and you're there in the lab trying to resuscitate the patient, perform CPR, or for midwifery you might have an obstetric emergency. So let's say the baby's stuck, the shoulders are stuck, what do you do? Or if the woman's bleeding out, what do you do? So it's really great hands-on experiences in the lab to get you used to working clinically. Yeah.
Thank you, Caroline. Justy, what does an average day in the life of a student look like? How much time do you spend in lectures? How much time with practical stuff? What does it look like?
So the nursing course is structured in a way that there is a mixture of lectures, workshops, tutorials, and like Caroline said, clinical learning environments. So in a week, you would have about 2 lectures, 2 or 3 workshops, and 1 CLE or 2 CLE sessions, depending on which year you are and how many courses you've enrolled into. But an average day would therefore be maybe a lecture, a workshop, or a practical class, and then just spending time consolidating what you've learned in class and probably doing a bit of your assignments and dedicating some time to that. But nursing is a degree that allows you to sort of take time off in the day for yourself and just dedicating some of it to self-care, because the first thing that we learn in first year with nursing is how to prevent burnout and sort of incorporate that throughout the years in this course. So yeah, an average day is very manageable as long as we've sort of scheduled our hours properly.
Thank you. Anli, what's one tip you would give to someone who is going into a nursing degree?
I think definitely, whenever you need assistance or support, always ask for help. Monash is a very inclusive community, and when I struggle at something, I will talk to my lecturers, my tutors, or even the peer as well, because we are such a inclusive cohort. Most people, we kind of know each other, and the support I got from the course is instrumental, and I would definitely recommend for everyone that's interested in nursing to come to Monash and study and make lots of friends and have a very rewarding journey as well.
Thank you. Caroline, what support is there for nursing and midwifery students?
So there's a lot of different supports at Monash University. So in my experience, I have found the uni staff very approachable. So at Peninsula campus, you kind of know everyone by name, they know who you are. So your lecturers who are teaching you in the class, they work as a lecturer, but they're also usually working as a nurse. So that's like what Drasty said, lots of hands-on experiences that you can really draw and learn from them. So that's one. Then you have the library. So the library in Monash is a bit different from high school libraries. They actually give you a lot of support on, writing academic, reports and how to reference and all this uni stuff that's going to be brand new to you when you join. And they're really good. They run lots of different programs that you can attend for free, and as well as kind of do one-on-one kind of like learning with the library staff. Outside of kind of the uni sphere, there's also lots of clubs and societies that can give you that support. So we have, for nursing and midwifery, we have a peer mentoring program. So what that entails is that all first year students get matched with a peer mentor, and the peer mentor is just a senior year nursing student who is, really passionate about creating that environment and community where everyone feels safe and comfortable to learn from each other. And we actually do like mini workshops, what to prepare for placement, how do you pass your first clinical exam, things like that. And then for peer mentoring, we also have different aspects of it. So we have something called transition to university programs. So those are for, students who may not be from high school. Maybe they're coming in as an enrolled nurse, or they're coming in, from, they might be, a mom or a more mature age student, and they decide to come back to university. We also have a T2U program, which is a transitional support program for students like that. We also have near peer teachers. So that means we have final year students who are, really high achieving academically. They come into those learning labs at the beginning to kind of help the first year students with their nursing skills. On top of that, we also have PASS classes, which are when second year students, they teach first year students about all the anatomy and things like that. And we also have support groups, which are social groups, which is called Monk, where we do our annual ball for nursing and midwifery students. And if you're international students, you can also access the international student support team, where they can help you with English and assignments. So there's a really, really massive range of support at Monash University. And when I'm on placement, I can really tell a difference. Speaking to other students from different universities, I really find that I'm really well supported at Monash, and that the communication channels between the faculty and the students are excellent. Yeah.
That's really great to hear. Thank you. Drusty, once you become a registered nurse, how do you specialise in an area? Is it done internally in the hospital, or do you have to get further qualifications?
So there's two pathways that I'm familiar with. The first one is, so at the end of the three is a very common pathway that all nursing students take is trying to apply for a graduate year. So a graduate year is essentially a position of a registered nurse in a hospital, but as a graduate nurse. So they very well understand that you're very new to the field and you're there to essentially learn and transition into being a registered nurse. So when we get a graduate year, we can always apply to a graduate year in a specialty area that we are keen on. For example, if I wanted to specialize in ICU nursing, that's where I would apply to. And once I get a graduate year in a specialty area, they would essentially train me in that specialty area. And then after the end of my 1 year contract, I would then, so it's essentially done internally within the hospital. But there's also the option of doing a postgraduate degree, where you could either do a diploma or a master's degree after your bachelor's to go and further specialize into whichever field that you're keen on and go down that way.
Thank you. Anli, can you get work in the ICU or get into the ICU with just the Bachelor of Nursing, or do you need a master's?
Yeah, so Monash, they really prepared us from aged care to specialty areas. So usually for the last year in our course, some of the students, they will be placed in special areas such as ICU, emergency department, or even pediatric. So I did my placement at pediatric, so that's a specialty area as well, and that's been really good, and I really enjoyed it as well. And doing those specialty areas, that really helps you to, I guess, develop your interests and see if whether you like those kind of areas and you want to do some further study as well. And just what Justy said before, Monash, they do have like a Master of Nursing practice that you can essentially specialize in different clinical areas as well. And yeah, I think those kind of opportunities been really good for everyone. And with the such a good high reputation at Monash, I think that's a really good experience for everyone.
Wonderful, thank you. Caroline, could you possibly describe the advantages of doing a Bachelor degree of Nursing and Midwifery compared to just nursing on its own? How will or how could future students know whether midwifery is right for them?
Well, I want to say from the start that I think Bachelor of Nursing, Bachelor of Midwifery, Nursing and Midwifery, both very, very high qualifications, and I think you come out of it, equally, strong as a practitioner. I think the differences is perhaps in terms of employability. There's a little bit of it's a bit higher if you do the double degree in areas such as rural health, or if you want to. So if you're interested in working, in rural Australia, or you want to, be part of the doctors, Royal Flying Doctors, things like that, you need a midwifery background. So if that's kind of an area in your long term, that's something to consider to do the double degree. And in general, I think I think it's more of if you're doing the Bachelor of Midwifery on its own, having nursing, I think, gives you the opportunity to really get to grips with, how do you kind of help, unwell patients. So, usually midwifery is usually quite, low risk, quite, beautiful in a way. It's quite different from nursing where, so someone who's unwell, what's the plan for them? How do I get them better? And these are the steps I need to achieve this outcome, and I want to get them out of the hospital a better patient. Whereas midwifery, you have, a woman who's pregnant, and it's quite a life-changing experience for them. It's a journey, and as a midwife, the word midwife means with women. So you have to love women. You have to really be able to support them and individualize their care. So for example, what I'm trying to say is that if you're tossing up between, do I do midwifery or do I do a double degree? Do the double degree, because your employability is better, your skill set's going to be a lot deeper. If you're tossing up between, do I do nursing or do I do the double? It kind of depends on, do you want to do midwifery? And for midwifery, it's about women-centered care. Do you like having to support women in labor who might be in a lot of pain? Are you going to be comfortable doing that? Talking to women, encouraging them, giving, massaging, giving them heat packs, things like that, but also be comfortable with, high risk pregnancies as well, and labors where, something might go wrong, but usually not, but you know what I mean. And so at Monash, it's really flexible. So you can come in doing the nursing degree and then kind of transition to do the double degree, or you can join the double degree and then after placement realize maybe this is not for me, and also have swap back down to the straight nursing. So it's just a really flexible course that you can do. So yeah.
Thank you, that was some great advice. Rusty, how did you find the transition from high school to university, or nursing specifically? Was it very difficult? How would you describe it?
The idea of coming into this whole new country, from a third world country, and then learning a whole new education system, it did seem quite daunting at first. But as soon as I got into, as soon as uni started, and as soon as I got into Monash, it was extremely smooth. We had so many. There was so many support systems from the academics, from the university itself, in that just in the start, during orientation week, we had multiple seminars, multiple events where they not only broke down everything that we could possibly expect to do in this course, but they answered all of the endless questions that I had. They were extremely supportive. like Caroline said, there's also the library resources that had a lot of these workshops that helped us understand what kind of academic articles and what kind of assignments that we should expect and how to go about them. As an international student, I had support from this team called SASU, which helped us understand assignments and break them down and tackle them in a very concise manner. So I personally had a lot of support, and I didn't even realize that it was a struggle at all. So that transition for me was quite smooth.
Thank you. That's really great to hear that it was a smooth transition. It's what you want. Unli, where can you do your nursing placements? What's on offer for students?
So usually there is like a clinical placement office that will allocate students to areas within Victoria. And most of the time they will preference based on where your location is. So they will try to match it with somewhere that is close to your house. Sometimes if it's still quite far away from where you live, then you can swap with other students. The clinical placement office are very flexible when it comes to swaps. And for placement, it could be from aged care to specialty areas, ED, pediatric, etc. And it could be from a private hospital, and it could be in a public hospital as well. So there's a different range of variety out there. And I think it's also very important that because they understand that they want you to feel safe and supported in this pandemic, really. So they want to really support you in the way and try to communicate with you and the other hospital as well. So making sure that you have your PPE's knowledge ready, you know what to follow and how should you talk to other peers about if you're having an issue. Those educators are always there for you to, when you need some advice as well. So yeah, I think placement has been really good and I really enjoy it as well. Thank you.
That's so great to hear. Thank you. I now have a question for all of you. I think perhaps we'll just continue in the same order and you can just answer one after each other. This question's from the audience. So what has been the highlight of your degree so far? Caroline?
Well, I think the highlight of my degree so far is kind of being able to deliver babies. I think that's probably my favorite part of the double degree. And so as a part of the midwifery program, you have to have a portfolio. And part of that is also finding women where you follow them throughout their pregnancy. So from their early stage when they first find out they're pregnant, and you kind of go along this journey and develop that relationship with a really nice lady who decides to have a student come along with all the appointments and everything. So it's really nice. So, and there was an opportunity where I was the one who actually delivered the baby for this lady. So it was really special, that relationship you built from the beginning, to the time of delivery, actually having the baby, handing over to the woman, and it was just beautiful. It's beautiful. So I think that's the beauty of the double degree, and that's my highlight, I think. Yeah.
That's so gorgeous and special. That was a great story. Justy, what has been the highlight of your degree so far?
The highlight of my degree has a number of satisfaction, going out there on placements, interacting with actual patients who have been in hospital for a really long time, going there, learning about their life, learning about their story, providing them with care, with quality care that you've learned at uni, and seeing that smile on their face, hearing a thank you from them, and probably getting a card when they're getting discharged with your name on it as a student. I think that was beautiful. It made me feel very, very empowered, knowing that I have the ability to make a difference in someone's life. That's been the highlight of my degree.
Beautiful. Unli, what has been the highlight of your degree so far?
I think definitely clinical placement is one of them, and I think also the community in Monash is it's so awesome, and I don't know how much I appreciate that the support environment that I have, and it just really helped me, even though I experienced a little hiccup in the beginning of the year, but it really helped me to be perseverance and working hard on my studies and manage my time as well. And as for clinical placement, yeah, just you're caring for someone. Sometimes it could be really challenging at first when you experience that, but in the end of the time, you really, you try to make a difference in their life, just a little gesture, little greetings that really make a change in the patient and the family as well. We are there to learn, we are there to use our practical knowledge into practice. That is something that I find it really good in the practice, and I think Monash got everything that I need, and I really love my experience.
Beautiful, thank you. I've got another question for all of you. What advice would you give to students going into placement? I think this time you guys can just start one after another, but starting with Caroline again, please.
So, well, I just want to reassure everyone that, you're going to be kind of guided into placement. We're not just going to drop you off at placement and you're just going to like freak out and be like, am I meant to care for this person? Your university course in first year is tailored to prepare you for this placement, which will be happening, late in your first year of uni. So the first semester, you're going to be learning all the different skills. You're going to be taught, how do you communicate with someone? How do you talk to people from different ages? How do you kind of clean wounds? How do you put a catheter in? How do you draw blood? All of that stuff. You're going to be prepared for. So my advice is come to uni, learn from all the labs and learn from your university lecturers. Come for the peer mentoring program, which have little workshops on how to prepare for placement. And I think at the time you're going to kind of understand and be able to contextualize, your placement experience a little bit more before going in. And just my greatest advice is that you're on placement to learn and become a better nurse or midwife and have fun. So yeah, it's a good time.
Thank you so much. Justy, what advice would you give students going into placements?
A piece of advice I wish I had stuck to from the start of it was be kind to yourself. Whether you're in first, second, or even third year, sometimes there are going to be things that, you think that you should know at this point and you don't, some little things that maybe you mess up, and that's okay. It's very important to be kind to yourself, to go home and reflect that, okay, I did this and I didn't do it to the best of my capabilities, and that's okay because I'm still a student, I'm still learning, and it didn't have any detrimental effects. So trying to remember that you are human, and sometimes you will make mistakes, sometimes you won't be at your A game, and that's okay. That doesn't make you any less of an amazing nurse that you're going to be. So yeah.
Thank you. And Anli, what advice would you give to students going into placement?
I think it's really important for them to know that support is out there. You really need to go there and ask, and putting your effort and time into it. And of course, Monash University will help you to prepare for that. But you also need to make sure that you make some time for yourself, study some of the content just before the placement starts. And during your placement, you will have feedback from your educator, and based on the feedback, some of your strengths and weaknesses are, and try to improve on that, and ask them how to do certain procedures, for example. That really helps. And I guess also familiarize yourself with the hospital policies as well, because it's very important you're doing based on the policy, and you're making sure that you're doing the right thing, and of course for the patient as well. And I think that yeah, just making sure that you have when you're at home from the placement, make some time for yourself and try to just relax a little bit, treat yourself with a nice dinner or something like that. It will really help you to recharge and have your energy back.
Brilliant, some great advice. Thank you. Thank you so much for sharing your career insights with us today. That brings our session to an end. Thank you for all of you for joining us, and I hope this gave you a taste of what a degree in nursing and midwifery is like at Monash University. If you think these courses could be for you, make sure to visit our booths and have a chat with our staff. We hope to see you on campus soon, and best of luck with your studies. Thank you.